Beyond the Badge is brought to you by the Edina Crime Prevention Fund.
Bloomington Public Health serves the people of Bloomington, Edina, and Richfield. So my role in large part is on the front lines with the vaccine clinics, and we're needing to work with all three cities to plan those, to find out how many people do we need to vaccinate in each of those cities, and where can we safely do that, and how can we put up these clinics and run them safely. Right now we're building our capacity and we're building our capabilities to be able to vaccinate more and more people. And so we have EMTs and paramedics from the cities of Bloomington and Edina and Richfield that are working with us in partnership to provide these vaccines.
The chief sent out an email to gauge if anyone wanted to help out at these clinics, and I said, yeah, what a great opportunity. I mean, this is something we're never going to forget about. This is something that even when my kids grow up and to say, hey, this is what I got to participate in, and this is what I got to be a part of.
We've received a list of the EMTs and paramedics who would like to volunteer to work with us. And then we'll be putting them into our staffing. As the number of allocated doses increases, then we'll need more staff.
Most of us at Edina PD or the police department are EMTs. And so that qualifies us to give these vaccines. So part of that, we did some online training, and then we did some in-person training. So when we show up to these clinics, there's somebody here to do some one-on-one training with you. You observe some vaccines being administered, and then you yourself administer the vaccines with that one-on-one assistance, and then you're on your own.
We value their expertise, and we're just thrilled to have this partnership with them, because without their help, it's going to be really difficult to manage this, right? As we get more and more doses, we're going to really need their partnership in this.
Bloomington Public Health is a well-oiled machine. I mean, showing up here, as you saw inside, they have plenty of volunteers, plenty of staff directing people where to go. They've been fantastic to work with.
Hearing from people the relief that they've got the vaccine, that they feel more comfortable going back to work and doing those essential jobs that need to get done, that's really rewarding.
Last week, I'll never forget this, I gave a vaccine to a younger female, and that she stood up from her chair and she just started bawling, and she said, I finally get to hug my mom and dad. I finally get to hug my mom and dad. I've been waiting for a year for this. So it really meant a lot. So, and then as you saw today, the woman that stood up and said the same thing, she's like, I finally get to hug my grandkids. I've been able to see them from far away, but I finally get to hug them. You know, you think about it, you never thought we'd be in this position, you know, even a couple years ago. And a Zoom call can only go so far. You know, seeing your kids or seeing grandma and grandpa from afar and not being able to hug or touch them is difficult. So finally being able to do that means a lot.
Everybody's had a part to play, and it's amazing to see how far we've come and the progress that we've made, and then of course to get the vaccine and just to be there when we were giving those first vaccines. That was really an exciting day.